Hey everyone, this is Aaron and Juwan, and you're listening to Wellness for Real People. This show is for people who are on the go, busy, and looking for ways to live their best lives. We focus on wellness topics in mindfulness, exercise, diet, and sleep, and share quick, actionable tactics to improve your health and wellness. We're not perfect, but we're trying to get a little better each day. Let's grow on this journey together. Hey everybody, welcome to another episode of Wellness for Real People. Juwan and Aaron here, and we're discussing an article today from the Harvard Health Publishing from the Harvard Medical School Journal. And essentially what we're looking into is 5 numbers linked to the ideal heart health. This is an article by Julie Corliss, executive editor at Harvard Heart Letter. So definitely someone that has a lot of expertise in exploring the topics of heart disease and heart health. And so what we're going to talk about today are kind of the 5 most important numbers that can give you a good idea of how healthy your heart is. So blood pressure, blood sugar, cholesterol, and triglyceride levels, as well as waist circumference to get into it. So really this one kind of, made me take a look and a step back at looking at my numbers and how my heart health numbers stack up and really trying to identify where I stand with things. And it's a good kind of metric and a measurement to have, right? Because there's so many different pieces of advice you get. It's almost like you just need to put something more tangible to it, a number to it. It's like you kind of, yes, exercise, yes, diet, yes, but ultimately like our heart controls everything. And so just really trying to see that these key numbers are in alignment with where you need to be is a good way to kind of check your overall health. Of course, it's not a guarantee, but it's a much better indicator of overall health. So the first one up is blood pressure. And the article says that anything less than 120/80 is kind of in a good range. And typically, what really impacts that is going to be, your overall lifestyle in terms of like, what you're eating, what you're doing, if you're constantly stressed, if you're having a sedentary lifestyle, like all these things kind of lead into it. So really what matters here is like trying to lower that blood pressure level. And some of the things that they recommend that can help are diet, like vegetables, fruits, beans, all these things, and trying to minimize some of the bad stuff, right? Like meats, alcohol, and some of the other things that we know are just definitely not good for us, because when you go in excess in those things, it kind of encourages a buildup of fatty plaques. And all of that kind of really gets the heart's blood pumper enlarged and kind of like pumping at a higher level than you need it to. And if anything gets blocked or there's a burst blood vessel, that could lead to a stroke, right? Which we know is something that could be catastrophic. So blood pressure is one of those indicators, and something you typically check when you go to your doctor, but something you can check on your own too, and something to keep an eye on, because if your blood pressure is constantly above that 120/80 range is definitely an indicator of some concerns there.
Yeah, yeah, definitely want to chime in there. I think it's definitely something that's really, really important, and something that directly relates to me and my journey, right? So
Mm,
that I've had high blood pressure since I was a kid, actually, uh,
mm,
and so they never could really ever figure out exactly why that was the case. But my doctor made it a point to say, at a certain point, like, look, man, you really need to get this under control and do what you can through exercise, diet, and lifestyle. That's really, really important. But it got to a point for me where they're like, well, let's go ahead and get you on some medicine,
mm.
so that we can help control this and really keep it down. So to help hopefully preserve your health for the long term. And so I just want to throw that in there. Like, we talk about the things like that you mentioned, right? The diet rich in potassium, lowering your sodium, and the lifestyle piece that's really, really important. All those factors that are in your control. But then sometimes there's things that are maybe out of your control.
Some of it's genetic too, right?
Yeah, yeah.
Like, yeah, there's like these genetic factors that it's like, if you don't control these other things, like that extra layer of that genetic factor just accelerates anything like bad coming in, right? It's
Yeah,
just like,
exactly.
yeah.
Exactly. But then people will say, some people say, okay, well now I got this magic pill that okay, it's gonna lower the blood pressure. Okay, now I can just go back to doing whatever I want, right? And it's just yeah, it's like it's not like you mentioned, it's not either one or the other. It's really sometimes both and, but that lifestyle piece really, really is important. No matter what medications you're on. And so yeah, that really important first one, that blood pressure.
Yeah. The second metric that they discussed was LDL cortisol levels. They recommend less than 70 milligrams over deciliters. And, really when we're talking about that, the doctors are really concerned about those levels, particularly, because they can cause an excess of lodge inside your artery walls. And then once they're engulfed by white blood cells, they kind of form fat-laden foam cells. And, overall, that can really slow things up for your heart and have some negative impacts. They recommend limiting saturated fats, again, meat, dairy, and eggs. I thought that one was interesting because, you typically hear eggs is a good thing. But I guess, you in excess, right? Or if you don't have everything else in check, like those things can be detrimental to you. They recommend replacing those lost calories with unsaturated fats from nuts, seeds, and different vegetable oils. So something to think about there too, like there might be ways you can replace some of the dairy with maybe plant-based products, eggs, the same thing, right? Or meat in general too. I think it's easy to just fall into the trap of like, yes, I love like red meat, bacon, all that good stuff. It's just not good for your LDL levels overall. It's something to watch out for.
Yeah, yeah, yeah. As much as I love bacon, I gotta do it
Yes.
in moderation.
Yes, yes. And it's so interesting, man. Like when I was looking at this article and we were talking earlier, it's just understanding your levels. A lot of the times now we can kind of get that information from our doctors and keep track of it in apps and things like that. And so I have like health apps and things that are connected to my doctor. So I can see like after I do a blood test where my levels are at and where I need to make adjustments. And so it's just really powerful to understand like these numbers and where you're at. And they oftentimes give you a medium of where you sit in the spectrum. And so you say, okay, maybe I can work a little bit more here, work a little bit more there on, exercise and getting up and being less sedentary, or I can cut back on some things on the diet side, or I need to manage my stress levels. So it's just kind of amazing now that you can put some numbers to it to really target where you need to focus and hit some things.
Yeah,
Just
I
call that
agree.
out.
Totally
Number
agree.
three. Oh, good. Sorry. Go ahead.
And as someone who's very goal oriented, and you talked about this right at the top of the show, right? Just having a number to look at and to shoot for and to aim for and to beat, right? Makes all the difference. For me, and in terms of helping me stay motivated. Yeah, and so I agree with you. Just really powerful to have some clarity around some of these things and know what we can actually do to try to move the needle on some of these things. It's very easy to get overwhelmed or frustrated, right? But I love that the author talks about just a few, helpful ideas and tips for each of these areas where we can, make some adjustments and some changes to hopefully, continue to move things in the right direction.
Totally. And then number three was triglycerides. And so the recommendation is for your number to be less than 150 milligrams over deciliters. They say a lot of times like triglycerides are kind of a little bit less well known than cholesterol, but they still form fat in the bloodstream. And so typically this comes from excess calories, alcohol, and sugar in the body that can't be used. They're turned into triglycerides and stored in fat cells. And why that matters is because elevated levels of triglycerides have been linked to higher risk of heart attack and stroke. Right. So when you see that level spiking beyond 150, that's when it's a concern. And so when I was looking at my own numbers, it was getting a little bit higher. Like I was getting in like the 145 range. And I was like, oh man, like I got to cut back on some things. Right. So cut back on the sugar, cut back on some of these bad foods that are unhealthy or high in fat, and trying to switch to something more like fish. Right. Or kind of having a more of a seafood based diet instead of so much of a meat based diet. And then cutting back on alcohol. Like in Colorado, we have great local beers, but it's just one of those things where you got to just limit it and try to avoid it as much as possible, because just over consuming definitely can elevate those levels and lead to some heart risks.
Yeah. So the next one that they mentioned in the article, the author mentioned, is blood sugar, and the target there is less than 100 milligrams per deciliter fasting. So they talk about, how, blood sugar, high blood sugar is related to heart health. And, high blood sugar really defines the diagnosis of diabetes. And they say type 2 diabetes is most common, and it occurs when the body develops an insulin resistance. and does not produce enough insulin to overcome that resistance. And so, when diabetes is not maintained or under control, it can cause some really scary health uh, impacts. And I have stories and a history of that in some members of my family. So something that's very scary, and definitely want to manage that very closely. But it can certainly help to in the formation of of clots, which can trigger um, uh, a heart attack or a stroke. Um, and so they talk about what helps with kind of managing the blood sugar. They say avoid sugary beverages, foods high in sugar, eating whole unprocessed grains instead of and instead of foods made with really refined grains like white flour or white rice. So those are some tips that they offer. And I know that's a big thing, in our country and culture specifically, right? That's just like the hidden sugar in just about everything that we
Everything,
consume
every
and
delicious
processed food.
pasta, rice dish. You just, I don't know.
Yeah,
Oh,
yeah. Yeah, and a lot of the processed foods that we get from these wonderful foods that we love to eat from from the grocery store, but part of the way that they improve the flavor of a lot of these, foods is, I just put a little sugar in there. It's not terrible in any one thing, but it's just like when it's everything that, when every little thing that you eat, it can add up very quickly over time. So it's something we have to be really, really mindful of and aware of, and try to manage that, appropriately. So uh, that was the fourth measure that they talked about in the article. And then the last one was waist circumference. So the target here is whichever number is lower, less than half of your height in inches, or for women, less than 35 inches, and for men, less than 40 inches. And so they say, in order to measure your waist circumference properly, they say measure your waist around your bare abdomen, just above your belly button. And they talk about, when you have a big belly, or what doctors may call abdominal or visceral obesity, it usually means fat surrounding the internal organs. And why that matters for heart health is that visceral fat secretes hormones and other factors that may encourage inflammation, which can trigger the release of white, blood cells involved in atherosclerosis. Sorry, I can't say that 5 times fast, but yeah. So what helps with this? One, just consuming fewer calories, especially those from highly processed foods, full of sugar, salt, and unhealthy types of fat. So a lot of the things we just talked about, right? A lot of those processed foods that we eat, and so uh, the article closes with some universal advice, right, to improve all 5 measures of heart health. Um, they really mention, especially focusing on excessive weight and weight circumference, because it can affect all these other measures, right? It can affect blood pressure, LDL, cholesterol, triglycerides, and blood sugar. So if you can get some of that weight down, then it can help across the board with a lot of these other issues. They say, eating a healthy plant-based diet can certainly help. My doctor's really big on the Mediterranean diet, right? And
yeah, you've seen that. Yeah, quite a couple times coming up now. Yeah.
yeah, and they talk about regular exercise helps. In terms of regular exercise, they mention aim for about 30 minutes of moderate intensity exercise, like a brisk walk for most days. And other lifestyle habits that can help lower your heart disease risk include getting 7 to 8 hours of sleep per night, and managing your stress level. And that's right in line with the themes of this show, Wellness for Real People. We recognize we're not perfect, right? We're all on our journey trying to get a little bit better every day, but really focusing on that mindfulness, mental health, piece, right? That exercise, that diet, and that sleep. And so those are the things that we can do, right, to try to be healthy and have a long, happy, healthy life. And so I thought this was a great article, really just talking about heart health and what to look for, what's important, and then what we can actually do to improve our heart health. Was there any other last kind of thoughts or aha moments that you wanted to share, Aaron?
Yeah, no, I think the biggest aha moment for me was just realizing that I'm like firmly in the middle or closer to like the lower side of things on a lot of these numbers. And so it was just kind of a reaffirming that I've definitely made some progress over the last year or two. During the pandemic, definitely was a struggle, slacked off quite a bit in a lot of areas. And so now trying to get back into more of a regular routine of exercise and eating better. And so it's just one of those things where it's just like, helps me to realize that having a number to it makes it easier to measure and easier to focus on what you need to do. And, it helps when you start to see those numbers come down. Tracking, you don't want to be obsessive about tracking numbers, but, give yourself some time, give yourselves a couple months. And then when you see those numbers come down, or if they're going up or whatever direction is, then you can make some changes there. It's not one of those things where you can kind of measure it daily, but just seeing it over time and seeing those numbers either go in a positive or negative direction is kind of help you make some choices and decisions. So I thought this was a good article to kind of help identify in terms of just heart health. There's so many other numbers and factors. Like if you open up your health app, there's like overwhelming things that you can track, but just trying to figure out, like, if I'm not going to do everything, what are these 5 things that are going to keep me alive, right? These are the most important 5 that are going to help my heart. So, I kind of took that as an aha moment for me, is like, yes, don't measure everything, but measure the right things and try to make impacts on those.
Yeah, yeah. I guess for me, as you were talking, it reminded me of another episode we did. I can't remember exactly which one, but we were talking about the sedentary life, right? And
Yeah.
how
Yeah.
detrimental that is. And so, a lot of the tips that they talk about in this article, and a lot of the articles that we've discussed on the show, is really around the importance of just daily movement as a lifestyle, right? And 20, 30 minutes a day, on average, and what that can do for your health, right? Your heart health, mental health, right? And so that's something that it's free, right? Just getting up and
Yeah.
moving and walking and being a little active, but can have a tremendous positive impact on our well-being. And so, I just want to keep that in the forefront of my mind, to get up and move as often as I possibly can, and for you, our audience, right, just want to encourage us all to be a little bit more active, and I think that's one thing we can do to help ourselves and help our hearts. So hope you enjoyed the article. We'll link the article in the show notes, and we'll be back with another great discussion on wellness for real people in our next episode. If you're getting some value from these episodes, which we certainly hope you are, please do leave a comment, and share this with a friend, right? If you find something helpful in our discussion, share it with somebody that could use this information, and because we want to spread this positive information, this healthy lifestyle, and try to help us all live healthier lives. So yeah, please do share. Sharing is caring. So we appreciate you, and we'll be back with another episode soon.
Thanks, everybody.